Welcome, everyone. Just giving folks a minute. I see some of you are still connecting to the audio. Okay, welcome, everyone. I am Jamie Strauss-Clark, facilitating this meeting today. This is the Behavioral Health System Redesign Steering Committee. This is, wrong title, Crisis Response and Improvement Strategies Steering Committee meeting. So we had the full CRIS Committee meeting last week. This is the steering committee. I know there's a lot of meetings, so I want to make sure I say that up front to make sure everybody knows they're in the right place. Before we get started with our agenda, I'm going to bore you with my usual spiel about how we use the technology, just to make sure everyone's on the same page. So Elizabeth or Brittany, if you could put up the slides, please. While they're doing that, I want to make note that you'll see Amanda and Andrea providing ASL interpretation today. They are currently spotlighted on your screen. So if you do need that ASL support today, they are right there for you through the whole meeting. They're in the same physical space today, so they'll be switching off every 15 minutes. Okay, do we have those slides?
1 second, just pulling them up.
Thank you. Okay, so if you could advance to slide 2, please. Wonderful. So I have 2 slides. The first one is for steering committee members. The second is for community members and guests today. So steering committee members, as a reminder, I'm going to ask that you keep your mics muted unless you're speaking, so we can avoid talking over each other. And if available to you, please keep your video cameras on. Elizabeth, if you could just advance, there's little arrows. There we go. And then as ever, we're going to use the raise your hand function. So advance one more time to indicate if we want to speak, offer a comment, ask a question. So click on that reactions button at the bottom of your screen, pops up. I think actually might have changed a little bit, but there's a raise your hand button right there on that pop-up screen. Advance one more time, please. Steering committee members, if you want to communicate via written sharing with me versus saying something verbally, please feel free to send it in the chat, and I will be checking the chat frequently and relaying back what I'm seeing there. Also, if you have any technical difficulties, please feel free to reach out to Brittany Thompson and she will do her best to support you. Speaker view, if you want to see as many of the steering committee members as possible, click on speaker view and then click on gallery view, and that will show everyone on your screen. Let's advance again, please, Elizabeth. So members of the public, as ever, thank you so much for taking time out of your day to be here with us. It is really meaningful that we have so many people really engaged in this process. I'm just going to walk you through how we're going to use the technology for people who are not part of the steering committee or supporting staff today. I'm going to ask that everyone else please keep your mics muted for the entire meeting, with the exception of if you're going to be providing public comment at the end, which I'll make a note. I'll say a little more about that momentarily. So please keep your mics on mute. Also, please keep your video cameras off. Again, not because I don't want to see your faces, but because it makes it easier for us to facilitate amongst the steering committee members if they're the ones on camera. Please advance. If you would like to see as many steering committee members as possible, again, click on that speaker view and then click on gallery view and you'll be able to see everyone. I am not going to be able to be responding to the chat today for our members of the public, with one exception. This is public comment. As you might have heard when you attended the CRIS, if you attended the CRIS committee meeting last week, many of the rules around Open Public Meetings Act that were suspended during the COVID-19 pandemic have been reinstated. So we're changing the way we're doing public comment. You hopefully saw an email about this last week. If you want to make a public comment, best thing to do would be to follow the instructions in that email and email ahead of time to let us know. That said, if you're listening today and you decide you want to make a public comment during that public comment period at the end of the meeting, 20 minutes that we're reserving, please send a chat to me to let me know that you would like to make a public comment. Please give me your full name. I will call on you in the order in which I received those chats. Also, typically we use a 2-minute timer for public comment. This is just for multiple reasons, but primarily to make sure that we can get as many people in as possible. If you need an accommodation, if you need a little more time because you have a condition or some other reason that you need a little more time, please also let me know. It's really important that I know ahead of time so I can go ahead and plan for that. So I'll try to put out a reminder about public comment a few times during the meeting, but hopefully that's clear to everyone. All right, we can stop the share here. All right, before we walk through the agenda, I would first like to hand it over to Mark Snowden, who's going to offer both our welcome and our land acknowledgement today. Mark?
Thank you, Jamie. It's a pleasure to be here. For folks who don't know me, I'm Mark Snowden. I'm a professor and vice chair in the Department of Psychiatry with the School of Medicine. And I'm the chief of psychiatry at Harborview, and I sit on the steering committee as the representative of the Behavioral Health Institute at Harborview. It's my pleasure to welcome everybody to the meeting today. I think it's exciting that we are now past the weekend launch of the 988 number, and I want to congratulate Michelle Roberts and all of her folks at the Department of Health, as well as the folks from the call centers for what I think was a successful preparation and launch for that. It's also an exciting time because I think for many of us, the launch was the first, but it is certainly not the only, or maybe even the thing that we have the most work to do. I think the other aspects of a crisis response system around mobile crisis outreach and having a place for people to go that would expand the options that are currently available to us are bigger opportunities as well as challenges. And so it's nice that we can move into that work, I think, in a more direct way now. So still a lot of work to do, and I'm happy that everybody is here today. As I mentioned, I work at Harborview Medical Center, which is part of the University of Washington. And I must acknowledge the Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Suquamish, Tulalip, and Muckleshoot nations. I add that we are on the traditional land of the first people of Seattle, the Duwamish people, past and present, who continue to pursue federal recognition. The tribes invest heavily in what I think is exemplary natural resource stewardship programs. I wish to personally thank the tribes for this stewardship, and I would encourage everyone who lives in the Seattle area to learn more about these efforts and to be equally conscientious stewards of the land, as well as supporters of the tribe.
Thank you so much, Mark, for that heartfelt welcome and land acknowledgement. So then I'd like to just make sure that everyone who's here today knows the steering committee. And so I'm going to ask steering committee members, I'm going to call on you in the order I see you on the screen. I'm going to ask you to introduce yourself and your agency and role and your pronouns. And also so our community members and guests can get to know you a little better. If you're willing, if you would share what you had for dinner last night. This is hopefully an easy one for you to answer today. I will start. I'm Jamie Strauss-Clark, she, her pronouns. I'm the facilitator. And last night I had Red Mill veggie burger with chilies on it while sitting and looking over Finney Ridge at the Cascade Mountains. I had to add that, and shared a beer with my husband, and it was absolutely delightful. Mark, I know you already introduced yourself, but can you also make sure everybody knows what you had for dinner last night?
Sure. I went to a department picnic where I chose not to eat so that I could keep my mask on, but I went home and had a wonderful chicken salad that my wife had prepared for us with grilled chicken and a special sauce that she makes with capers and white wine, and it was quite lovely.
I would really love to come over for that next time she makes it. That sounds fabulous. Sounds like it was a good decision to skip the picnic dinner then. Let's see, let's go to, I'm going to call in the order I see on my screen. So Bipasha. You are on mute, Bipasha.
Well, of course I am. My name is Bipasha, she, her pronouns. I serve on the CRIS and as a non-voting member of the steering committee. I'm a person with lived experience of mental health struggles and a survivor of suicide loss. I have also been a long-time crisis line phone worker and a community advocate for mental health. Oh, what did I have for dinner? I had the Mexican food, some chicken tacos, and I'm just glad the sun's out and it's pretty here.
All sounds very good. Thank you, Bipasha. Carrie.
Hi, thank you. Carrie Waterland. I use she, her pronouns. I am the director of the Division of Behavioral Health and Recovery at the Healthcare Authority, and I sit on both the CRIS and the steering committee in that Healthcare Authority seat. And I really wish that we would have asked what I had for dinner 2 nights ago because I made food, but I will be honest so that people know what we had for dinner last night because I decided I did not want to cook. We had Carl's Jr.
I bet the kiddos appreciated that.
I gave in, I tell you.
Carrie, I got to tell you, you could have totally fudged that one and you told the truth. So that was beautiful. Thank you for that. Let's see. How about Michelle Roberts?
Good afternoon, everybody. Michelle Roberts. I represent Department of Health on the steering committee, and I'm the assistant secretary for our prevention and community health division. And last night for dinner was kind of special because I picked up my daughter in Seattle from summer camp, which is the same summer camp I went to as a child. And we went out with friends for sushi. So
that was her first meal away from camp.
Yep, her first meal, yeah. And it's not an inexpensive meal when you've got hungry teenagers who have been eating at camp for a week. So
yes, I hear you on that. How about Senator Dhingra?
Good afternoon, Manfred Dhingra, State Senator from the 45th Legislative District. I use she, her pronouns. I'm the Deputy Majority Leader in the Senate, and I sit on the CRIS and steering committees as well. And last night for dinner, we actually had a very yummy broccoli and brie souffle, followed by a chocolate souffle and a lovely red wine to go with.
Wow, that sounds like a really good night. Thank you, Senator Dhingra. I don't see Senator Orwell yet, or Representative Orwell, unless that's you on the phone there. Representative, nope, okay. And Amber Leaders got called away to a meeting, so she's not able to join us today. So Betsy.
Okay, first, Jamie, thank you for not doing the karaoke song thing. That just threw me off. So I actually cooked last night, which is a little bit of a miracle. So I'm very happy to report that I had sheet pan crisp tofu and sweet potatoes. Yeah, with a scallion kind of rice vinegar marinade on top. It was really tasty. I haven't cooked for weeks, so that was perfect question, Jamie.
Okay, nicely. Yeah, that I realized last time that the karaoke question required a lot of extra consideration. So I thought hopefully everybody can remember what they had for dinner. Although to be honest, there are times when I do not remember. So thank you. So Elizabeth, if you could put the slides back up, I'll walk everyone through the agenda today. All right, there we go. All right, so our objectives today, could you just pop up one slide there, Elizabeth? There we go. So objectives today, we want to make sure we've caught up the steering committee on updates, particularly around subcommittee activities. The main focus of today is to discuss convening a work group to consider and develop crisis system outcome measures and targets that can be used as the basis of for budgeting. And then we'll confirm action items and next steps and reserve the last 20 minutes for hearing public comment. So just a reminder to folks, if you do decide you'd like to make a comment, please do send me a chat and also let me know if you would need an accommodation to go beyond 2 minutes. If you could advance the slide, Elizabeth. So here's the timing. We're going to move right into our personal story today. After that, we're going to hear subcommittee updates. And then we'll discuss a proposal to form crisis system outcome measures and targets work group, as I just mentioned. We'll do action items and next steps, hold the public comment period, and then adjourn at 2:30. And I see that we maybe didn't put enough time in the personal story there. So we'll take as much time as is needed for that. Not to worry, we've got plenty of time today. And that is definitely a priority aspect of our agenda. And now I would like to turn it over to Bipasha Mukherjee, who's going to introduce our speaker today. Bipasha.
Hello all. Today, it is my honor to introduce everyone to Shoma Gumansing. She reached out to Nicola and me to share her story, and I'm so glad that she did that. Shoma, also known as Chef Sho, is a self-employed artist, chef and caterer, small business entrepreneurship consultant. She owns and runs Tech Chef Productions that she established in 2014. She self-identifies as a woman of color, a first-generation American via the Caribbean. She says about herself, "I'm a person living with serious mental illness, SMI, for 31 years and counting and going strong." Take it away, Shoma.
Can you hear me? Can you hear me, everyone? Okay.
Oh, Shoma, we actually just lost you. Sorry, you just went on mute.
How about now?
Yeah, is there a way you could get a little closer to your mic? You're a little bit faint.
How about now?
That's
that
perfect. Thank you so
Okay.
much.
Okay, good. Okay, I've never done this before, so excuse me if I'm nervous. I'm here today in support of Initiative 1477 in the 988 crisis hotline. It's my goal today to be a small part in helping the behavioral health crisis response system be successful as possible. That being said, I'm going to tell you my personal life experience with the mobile crisis response team here in Seattle that I had. Just say a little bit myself in relation to this experience. First generation American from the Caribbean. I live with bipolar, PTSD, anxiety, and OCD. I am a client of the behavioral health system and their services at Harborview Medical Center, outpatient. So my story goes as follows. On June 30th, 2022, I was having a behavioral health crisis. I was really manic and I was having suicidal ideation. And so my psychiatrist from Harborview was concerned that I was alone. So she called the Seattle Police Department to come check on me on a wellness check. So when they got here, there were 6 cops. It was super intimidating, but they were super nice, it turned out. And they were asking me questions like, how did you get to this place today? And, you know, it's really dark in here. You want to turn on some lights, you want to go outside. It's super nice. They were trying to get to the story of how I got to where I was and how to get me out of that situation. And so that was surprising and a nice surprise. So then they gave me a choice to either go to the ER with the ambulance that was waiting outside or to have the mobile crisis team. And it sounded great not to leave my house and not to go to the ER. That's really traumatic going to psychiatric emergency services there. So that was a great option, I felt. So they had them come. So the cops left and told me to call if things escalated. and that the mobile crisis team would be here in about 30 to 45 minutes. They got here in about 35 minutes to 40 minutes, and they buzzed my bell, and I buzzed them in, and I got back in bed. So to give you an idea about my apartment, it's a studio. There's a hallway between the door and the main room. And so they knocked at my door, and then they come in, but just barely. And she says her name and her partner's name. And then the first thing she says to me was, you don't have to talk to me if you don't want to. And I was like, okay. It was something that she would repeat 3 times in the short duration of our encounter. So let's see, I'm sorry. So I told them graciously to come in, and it was really uncomfortable. Like, they were just kind of standing at my door, and I'm over in the next room. There's about 10 feet between us. And so she says that, and then there's like no reason for them to be, they can sense their uncomfortableness at this point. And you could there was just 10 feet between us, and so it's the tension in the air was starting to get really strong. And like, there's no reason to be intimidated by my apartment. It's like thoughtfully furnished. It's immaculate. Like, smells like candles. Like, and except for at one point I lit a cigarette, I got so nervous. With them sitting there. So, but besides the cigarette, there's no reason to be intimidated by the apartment. So I didn't understand them just standing by the door. And the only conclusion I could personally come to was because I am a woman of color. And so that was obviously offensive to me. And so they, let's see. Yeah, she asked me like just a couple like really random questions. And then she said again that I don't have to speak to her if I don't want to. And at that point, I decided to end the encounter because it was, so uncomfortable. And she didn't give me a business card. She didn't give me any resources. At one point, I was wondering if she even knew why she was here. So they left, and that was the end of the encounter. Let's see. Yeah, so from the beginning to end, the encounter was less than satisfactory. I thought it was great that they came promptly, and that just in general that there's a service provided like this, because it's something that's very needed in this community. To not have to be thrown in the hospital every time you have an episode. So I was really excited about that perspective. It definitely needs some improvement, without a doubt, and like some sensitivity training would be like number 1 on the list by what I experienced with these people. I'm sorry. So yeah, at the end of the day, it was just very uncomfortable. Like, I did feel, just as a woman of color, like with this kind of disability I have, there's all kinds of things running through my head, and I would hope that would never happen to anybody else. And what they should have done was come in and did what the cops did, like ask me questions like, why, how did you get to this place today, things like that nature, and they did not do those things. So something along the lines of like a protocol being set for them to, have an agenda of what to say and how to say it, and be aware of people's differences and embrace the differences in people and move forward. So that was my experience with the mobile crisis team, and I'm Shoma.
Thank you, Shoma, for bravely sharing your story. I say bravely because we live very much still in a world that stigmatizes mental health and substance use issues, when really They're simply health issues that need to be treated like we might treat an episode of the flu or appendicitis. In this kind of judgy world, to come forth and share your story is an act of courage. In addition to better training, Shoma, your story highlights the importance of equity, real diversity, and true representation at every level of our behavioral crisis response systems. Thank you for being vulnerable, inspiring, and for holding us to account on what needs to be done to build a strong system that meets people with humanity where they really are. Shoma has said that she's willing to have anyone contact us. If you want to, please reach out to Nicola or me, and we'll pass that on to Shoma. Thank you, Shoma.
Shoma, thank you so much. The timing of hearing this story is really powerful too, because we are talking in depth over the next several meetings about those mobile crisis teams. So actually hearing the detailed experience that you shared is really, really helpful both to the steering committee and for members of the CRIS, who are many of whom are on the call today. So again, I echo Bipasha in thanking you for reaching out to us and offering to tell your story today.
Thank you. Proud of
Yeah,
me.
it's delightful to have you. Thank you. All right, let's move into updates. Betsy has some updates on what's happening with the subcommittees, and then I'll check in with the other steering committee members to see if there's any other updates to share at this point. Betsy?
Thanks, Jamie, and thank you, Shoma, for your story. It was a really powerful testament to your experience, and I always appreciate hearing the personal stories, so thank you again. I want to share a little bit more detail about what our subcommittees are working on with the steering committee, and to also say that after the steering committee meeting, we will be sending out a summary of all of the subcommittee meetings. It will be posted on the CRIS for folks to dig into if they're interested in more detail. And there is a lot of detail in the summary. It's about 40 pages. So it's a good read. Okay, can we advance the slide? So just as a reminder of our structure for the work that we're doing, the advisory work for House Bill 1477, we have a steering committee, which is this body that has gathered today, and its role is to make recommendations to the governor and the legislature. It is informed by the CRIS Committee, which is made up of 36 or so members representing a variety of sectors. And its role is to advise the steering committee as it formulates its recommendations. Subcommittees are structured around discrete topics, and they provide professional expertise and community perspectives to the CRIS and the steering committee. And we have 5 subcommittees that were established in the legislation, and we added, or the steering committee, I should say, added 2 additional subcommittees, the Lived Experience Subcommittee and the Rural and Agricultural Communities Subcommittee. Next slide. So this is a little bit of a framing for you as I go into the subcommittee updates. The House Bill 1477 charges the CRIS committee and subcommittees in advising the steering committee to do a number of things, and these are listed 1 through 8. First is to recommend a vision for Washington's crisis response and suicide prevention system. We have done that, and the vision has been adopted. We are to make equity recommendations to promote equity in services for individuals of diverse circumstances. And that work is moving through subcommittees and to the CRIS and ultimately to the steering committee. We are to weigh in on service goals, identifying quantifiable goals for the provision of statewide and regional behavioral health crisis system services, and targeted deployment of resources. So weighing in about the services as well as how we should allocate recommendations about allocating resources. develop a plan for statewide equitable distribution of crisis stabilization services, behavioral health beds, and peer-run respite services. So very concrete recommendations that are asked of us. The work also entails a quality and oversight, identifying crisis system goals, and a process for establishing measures, targets, and oversight of the system to make sure that the system is operating as intended and in a quality way. And I will be speaking in a little bit more to that process, a proposed process for establishing measures, targets, and an oversight body. Also, we are charged with looking at cross-system interactions, examining and defining complementary roles in interactions for a broad range of entities involved in the crisis system. So this is the handoffs, the system working as a system, partners making referrals to one another. That's 911 to 988 and out to the regional crisis lines, looking at how mobile teams are dispatched, those types of things. We're also charged with making recommendations related to staffing and workforce needs by regions. And this includes staff education and training requirements for all call center hubs. Also charged with making funding and cost estimates for each of the components of the integrated behavioral health crisis response and suicide prevention system. This work will inform budget needs and funding recommendations. Sorry, Jamie just popped up and I can't see my number 8. That's okay. And also advising on the technology and platform needed to manage and operate the behavioral health crisis response and suicide prevention system. This is this speaks to interoperability, how we ensure that all of the partners can communicate with one another. And that lives in the Section 109 technical and operational plan. And I'll speak a little bit more to that shortly. Okay, so that's an overview, and now I'll get into how our subcommittees are addressing pieces and parts of these requirements. So first off, our cross-system collaboration subcommittee, whose charge is to examine and define complementary roles and interactions among crisis system stakeholders across the continuum of crisis response, has been working on behavioral health crisis system current state process map as a foundation to inform future state recommendations. I mentioned this in the previous slide. We have been focused on the intersections between 988, the regional crisis lines, and 911. We've identified areas to improve cross-system transfers, such as a common definition of imminent risk for all transfers to 911, or I'm sorry, for transfers to 911 across all entities. We've also been working our plan to get feedback on equity. We're doing that through all of our subcommittees, and we did that with our cross-system collaboration subcommittee as well. Next steps for this subcommittee are to consider process map interfaces with tribal systems as well as children and youth. And we are looking at what the role of 988 call centers and regional crisis lines is in the future. We are moving forward with the definition of roles and scope for those entities are pending further guidance. So we're working those pieces as we can. Next slide. The technology subcommittee, which examines and advises on issues and requirements related to the technology and platform needed to manage and operate the behavioral health crisis response and suicide prevention system, has been deeply involved in a discussion and providing feedback on HCA's development of the Section 109 technical and operational plan, including looking at functional requirements, what's happening in other states, and a robust conversation at the last meeting about mental health advanced directives. Again, provided some feedback to promote equity in services and just completed a slew of vendor demonstrations. And these are vendors from various places and states who met functional requirements. So we did these vendor demonstrations so that the folks on the tech subcommittee could understand what the key issues are and have a little bit of a picture in their minds as we go forward about the various offerings. Next steps are to review a draft of the Section 109 Tech and Ops final plan, and that is upcoming early this fall. Next slide. Our Credentialing and Training Subcommittee informs workforce needs and requirements related to behavioral health system redesign components outlined in House Bill 1477. And that group has reviewed current national suicide prevention line, call center training and staffing requirements. So those are federal requirements that the NSPL hands down to the call centers. And we did that to develop a baseline understanding of current state processes or practices to inform recommendations going forward. We looked at equity. And next steps are to discuss and make some recommendations for standardization of call center hub trainings and staffing requirements, as well as talking about training and staffing for mobile crisis teams and potential recommendations. And Shoma's personal story, I think, will help to inform the discussions that we have about our mobile crisis teams. Next slide. Our lived experience subcommittee provides diverse lived experience perspectives into the development of our behavioral health crisis response and suicide prevention system. Bipasha is one of the co-facilitators of our lived experience subcommittee and helps to pull forward topics for consideration. And this is all related to items of interest of the lived experience subcommittee. So work to date has included developing a shared understanding of lived experience, providing feedback on the vision and guiding principles that were ultimately adopted. We got feedback on the promotion of equity and services, as well as feedback on the crisis response system with a focus on mobile crisis teams. So at the last meeting, we heard from folks about their experience with the someone to come with mobile crisis teams. Next steps are to continue to bring lived experience perspectives into the room to inform the crisis response system changes needed. And as I mentioned, we're looking at topics that are of interest to the group. And so far that has included talking about youth services and peer support specifically. Next slide. The Rural and Agricultural Subcommittee provides rural and agricultural community perspectives into the development of the crisis response and suicide prevention system. Work to date has included providing feedback on the draft vision and guiding principles. We got some feedback from the group at the last meeting on our approach to Medicaid claims and encounter data analysis, the data analysis that we presented at the last CRIS meeting. We got some help to determine service gaps in rural areas, and they helped us to think about how we would want to kind of collate the information and think about our analysis for rural areas. We got some feedback to promote equity in services, and we reviewed the mobile crisis teams kind of current and future state and how they might be adapted in rural areas. And Matt Gower from the Healthcare Authority did a nice presentation there. Next steps are to discuss rural and agricultural perspectives on our system across the continuum related to a place to call, someone to come, and a place to go. Next slide. I think this is the last subcommittee, our Confidential Information Compliance and Coordination Subcommittee. It's a mouthful, which examines and advises on issues related to sharing and protecting health information that's needed for an effective system. We reviewed current NSPL call center privacy standards to understand a baseline of the current state that will help to inform recommendations. The group also received an update on the technical and operational plan, and specifically related to information privacy considerations. And we got feedback to promote equity in services. Next steps for this group are to review the technical and operational plan, and also to discuss topics that are brought forward by other subcommittees related to privacy and confidential information. So lots going on in that subcommittee as well. Oh, I'm sorry, there was one more. The tribal subcommittee, which examines and makes recommendations with respect to the needs of tribes related to 988. Work to date has focused on engaging a tribal government to government consultation process. We are in moving through a process of getting guidance through a roundtable format, and then ultimately through tribal consultation. We've gotten feedback on the draft vision and guiding principles. We got feedback on the initial assessment that was submitted last January with the tribal system perspective. We've gotten some feedback on equity and have, as I mentioned, a parallel process to engage tribal roundtables and consultation, and this related to the Section 109 technical and operational plan. So what we're doing with the tribal subcommittee is essentially bringing forward similar issues to what go to the CRIS to the tribal subcommittee for feedback. The tribal roundtables and consultation on the recommendations will happen in the fall. And we are planning also to engage a discussion of the cross-system crisis response system process map and how it intersects with tribal systems. Okay, that was a lot. I think, Jamie, we're going to answer any questions, or
yeah, let's pause
hand it
for
back to you.
let's pause for questions from the steering committee. Elizabeth, if you would stop the share for a moment. So steering committee members, that was a lot to digest. Any questions for Betsy? Okay.
Well, I'll just say I'm very impressed with all the work that's happening. So thank you all, everyone.
Yes, Senator Dinger, we have very engaged subcommittees, and the work is moving nicely. And I'm hoping that you all see the link from that initial slide that I presented about the charge, the requirements under 1477, and how and that you saw the thread of how the work is moving through subcommittees to then go back to the CRIS and ultimately to the steering committee.
Betsy, before we move on, since we just have a moment here, I did get a question from a guest, and since we have a couple minutes of time, may I just relay this question to you, and you can let me know if it's something you can answer here.
Sure.
Or so this is from one of our members of the public today. The question is, will advanced directives be inclusive of integrated care?
That is a technical question that I am not prepared to answer. But what I will do is take it back to our internal teams, HCA and DOH, and make sure that we are flagging that for consideration.
Great, thank you, Betsy.
You're welcome.
All right.
I'll just add, sorry, because I worked on this quite a bit a couple of years ago on the new bill. The legislative intent really is that people have the resources to self-direct care, and having mental health advanced directive be part and parcel of care across the spectrum is critical to that. So I'll just add my 2 cents on, yes, I would love to see mental health advanced directives be part of everything we need.
Okay, I see Bipasha, and then it looks like Mark might have come off of mute too. So we'll see. We'll start with Bipasha and then go to Mark. Bipasha?
I just wanted to reflect in conversations with the lived experience, having the ability to have advanced directives available, in the moment of crisis is important to that community. And I know there's conversation going about on how to incorporate that into systems, but just wanted to bring that forth, that it's an important part for the lived experience.
Thanks for
Yes.
bringing in that perspective, Bipasha. I appreciate it.
And just, Jamie, just to clarify, mental health advanced directives, absolutely. I focused more on the question around integration, and I was not prepared to speak to that, but we are focusing heavily on mental health advanced directives and how to incorporate them. So yeah, it's more, to me, it's more of a technology question that I wanted to defer.
Thanks for that clarification, Betsy. Mark, did you want to jump in here? No. Okay. Great. Then just checking in with steering committee members, any other updates relevant to the steering committee that you want to share before we move on to our discussion? Okay, let's move into our discussion then. So you received from Nicola a proposal to form a crisis system outcome measures and targets work group. Betsy is going to walk you through that, and then we'll talk about next steps for moving forward. Betsy?
Thanks, Jamie. I have a document to share with you all. This is the proposal, and I thought best to actually walk through the proposal itself because those of you in the room who are not steering committee members would not have seen the proposal yet. So this is to, can we share that? Probably figuring out how to pull it up.
I'll pull it up, Betsy. I've got it.
Thank you, thank you. There we go. So this is a proposal for consideration to form a crisis system outcome measures and targets work group. And the reason for forming this work group, and I want to be clear that we're proposing a work group versus a subcommittee, because the work of developing these measures and targets really rests with agencies, with the Department of Health and the Healthcare Authority as the implementing bodies. But we think that it's very important that CRIS members and others have an opportunity to inform this work. And measures and targets are really also important in order to begin to make decisions about resource allocation. So with that frame in mind, I'm going to walk through this proposal for the steering committee's consideration. So House Bill 1477 charged us with identifying Washington's crisis system goals, outcome measures, and improvement targets, understanding that doing so is foundational to the work, and that the steering committee needs that information as a baseline and foundation to really look at additional services needed and associated resources. So until we have some benchmarks and targets and understand where we're going, we can't really do the good work of allocating resources appropriately. So I wanted to highlight that specifically among the key areas of recommendations set forth in House Bill 1477, the steering committee is charged to, and I'm repeating this because this is the basis for this proposal, to identify quantifiable goals for the provision of statewide and regional behavioral health crisis services and targeted deployment of resources, to identify a process for establishing outcome measures, benchmarks, and improvement targets for the crisis response system. And that's what this work group would do. That would be the process by which the agencies would bring forward recommended measures, benchmarks, and targets, and the work group could help to inform that. And then finally, to make recommendations for constituting a statewide behavioral health crisis response and suicide prevention oversight board, or similar structure for ongoing monitoring of the behavioral health crisis system and where this should be established. So that would be down the road, but all this work would help to begin to frame the recommendation for how the oversight board or similar structure would look. So if we can scroll down, Nicola, to the proposed responsibilities for this work group. So kind of repeating myself, the work group would support the recommendation of goals for the provision of crisis services, measures that might be considered for ongoing quality reporting. This would include an inventory of existing measures and would include both process and outcome measures. And this is not a suggestion that we recreate the wheel. We would be looking at existing data. We would be looking at measures that are considered best practices in other states. But it's very important that we look at measures and try to understand in phases what those, what our metrics would be that would tell us that we're doing a good job. The work group would also review and reflect on proposed targets for each measure recommended to be met over time. And then so 1 through 3 is essentially what the work group would do this year. And that would help to inform, again, the recommendations for resource allocation. And one of our charges for the report that's due this coming January is to make recommendations for resource allocation. So that's why this work is very time sensitive, and this recommendation for this proposal is timely. Additional work that would happen over time is represented in numbers 4 through, I believe, 8. There would be work related to gaps in data, trying to understand where those gaps are and what additional data needs to be collected to mitigate the gaps. Reviewing technical specifications as those measures move to be implemented. There would have to be an education and training plan for payers and providers on the selected measures. So there would be some discussion about that proposed plan. And then talking about a quality dashboard report, which would assist the state in providing the necessary oversight as we go forward. And then finally, as I mentioned in the beginning, that number 3 item above, the composition and structure of a statewide behavioral health crisis response and suicide prevention oversight board. So this group could begin to inform and make recommendations about what that oversight board might look like. Okay, can we scroll down? So the proposed members, and these are just proposed, this was Health Management Associates thinking about how we might dig into this question of goals, measures, and targets. We propose that the work group include no more than 20 members, up to 10 CRIS members who are interested in this content area with specific expertise or interest would participate, as well as diverse representation of crisis system partners. So up to 10 work group members would be added as subject matter experts from the Healthcare Authority, the Department of Health, Office of the Insurance Commissioner, Behavioral Health ASOs, NSPL call centers, Medicaid managed care organizations, and commercial health plans. And we propose that Megan Celadonia from the governor's office would facilitate work group meetings. And Megan is the 988 coordinator in the governor's office. And just to be very clear, state agencies would be responsible for staff support to develop the content. Again, agencies implement. And Health Management Associates would provide support on the development of the House Bill 1477 recommendations. So we would participate on the work group, but the agencies would be leading the charge. And then we would have the support of work group members to get us to the goals, the measures and targets to be able then to inform budget recommendations. And that is the proposal.
Okay, Elizabeth or Nicola, if you could stop the share. I'd first like to check in with steering committee members. Do you have any questions for Betsy or feedback on the proposal? Did I see Mark raise your hand? Mark?
Thanks. I like the idea. It reminds me a lot of how we created the work group around vision. I think the goals and identifying the beginnings of metrics and targets is comparable to that. I like the fact that we're mixing existing CRIS members and then other subject matter experts and keeping it grounded in the agencies. I think my assumption, and this is where maybe the question is that whatever the work group does would come back to the full CRIS, that we're not in any way looking to bypass the full CRIS, just like when the vision work group created its vision, that was shared with the full CRIS, so that the full CRIS, whether they are in the work group or not, gets a chance to weigh in on this. And so I think that would be the way to proceed. And I think the vision work group produced a very nice product, and that process I think worked well. And this to me is quite similar.
Thank you, Mark. Bipasha.
One question and two comments. Question, Betsy, can you clarify the thinking between the subcommittee versus the work group? I didn't understand that.
So Bipasha, the idea of a work group is simply to acknowledge that this is the work really lives with the agencies, and we want to enable the DOH and HCA to drive to the as much as possible, because they're the implementing arms at the end of the day. That was the thinking about the work group. And also it allows us to be fairly nimble. This is a lot of, kind of deep work. And we want that opportunity to be nimble and just kind of dig into the work. And sometimes a work group connotes that more so.
Thank you. I just wanted to echo what Mark said, is the transparency would be important, in the process. And in that vein, the outward facing public dashboard is, I just want to commend that part, especially for people in the community to be able to see what's happening, just to reinforce that transparency. And in terms of the section that was under measures, I would want to highlight, maybe to include over there, what the client experience is as feedback, as a measure to determine, how well the system is working. Because again, the goal of this, the CRIS, the bill from which comes the CRIS and the steering, is to serve the communities across Washington. So something that will capture client experience feedback is just, something that will be important. Thank you.
Thank you, Bipasha.
Thank you, Bipasha. Next is Michelle, and then Senator Dingra.
Well, I think I can see how this proposal is moving us in a direction of several things we've had a lot of conversations about, but we've not had any time to process yet as state agencies, just seeing this yesterday afternoon. And I think, and our teams haven't seen it. So I really feel like there's a lot we need to process. I see how this aligns with where we need to go, but I can't give comprehensive feedback on this today.
Understood, Michelle. Recognize that it's a lot to process very quickly. And I just want to share that the intent was to bring something to the steering committee because of timing. And because we have budget recommendations that are due in the fall, so they're, again, this time sensitive.
Yeah, and I
aspect.
understand that. I think there's some continuing for us to get on the same page about cart before the horse and which one, because there's a lot of different ways to continue to approach this work. I mean, I think in this, there's a lot thrown into this proposal about several pieces, and I feel like there's like getting to the goals. What is the system going to look like? Some of those pieces that fit with the recommendations, but some pieces of the performance measures and the detail really has to come from what the system is going to be and what those recommendations are. I think there's some great cross-cutting things as far as performance measures, like Bipasha just said, I couldn't agree more. What's our regular input of community feedback and some other things. Also thinking about how do we tackle recommendations around the Oversight Committee. That's something that I know Carrie and I need to talk with probably our leaderships at agencies about, and especially how that fits with some other state directives like the PAIR work, pro-equity, anti-racist work, which includes, there's new work starting at state agencies as directed by the governor's office, which includes more community input and oversight to all of our work as state agencies. So I just think there's a lot to unpack here. That I'm just obviously, as you can hear in my comments, just beginning to process in seeing this document for the first time.
Understood. And Michelle, just for a point of clarification, the Oversight Board would not be contemplated this year at all. It's something down the road. So, no, yeah, understand your processing.
Okay, so I have hands up from Senator Dhingra and then Carrie, and then maybe we'll talk about next steps given Michelle and Bipasha's feedback. Senator Dhingra.
Thank you so much. So I've been talking a lot about metrics and needing some data that's measurable, especially after our Arizona trip, where there are certain metrics that I think set the expectations of what the system needs to look like. Things like, what percentage of the calls have to be answered by our call centers? What is the response teams for mobile units? When someone or law enforcement or someone drops a person off at our crisis center, do we expect them to stay for 6 minutes or 20 minutes? So I think there are some that are based on best practices, that are based on what we have seen from other systems. And it's important to put them down on paper so we all know what we are working towards. And I think it's very acceptable to say we have long-term metrics that we want to reach and there's short-term metrics where we can go. But I do think designing the system goes hand in hand with the metrics. If we are expecting crisis centers to be available to everyone across the state, if that is something we're looking at, if we want people to not have to drive more than 20 minutes to get to one, it helps design where those centers need to go. So I do think this work needs to go hand in hand because we have to think through what kind of system we want, have the metrics so that we can all be held accountable to that system.
Thank you, Senator Dhingra. Carrie.
Thank you very much. Yeah, I am not going to take too long, except for to say that I do echo, and we at HCA, right, are where Michelle is at and in Department of Health, just needing to spend a little bit more time on it, acclimating the teams who already have performance measurements out there that are already in contracts. And I'd like to see any discussion on that piece. I know that we've got agency representation there, but those are not kind of pulled out of thin air. A lot of those are based on things that come from the federal guidelines. And so I think more conversation about what this could and should look like is absolutely warranted. Not ready today for a vote, but do have an idea of a friendly amendment in lieu of, which is knowing that time is of the essence. Is there a possibility that we set a time frame and potentially do some sort of an email vote, knowing and acknowledging that we do want to move this along, but I and HCA were not ready to weigh in any more than that today.
Carrie, thank you so much for raising that. And for the record, we also received an email from Amber Leaders before she had to go into her meeting, echoing many of the things that Michelle and Carrie have shared here. So I think Carrie's question is a good one. we're balancing some sense of urgency with the need to take a thoughtful approach in our agencies in particular, wanting to dig into this, understand what the implications are, and also maybe address some of the questions that Bipasha raised earlier. So agencies, or for everyone, steering committee members, what would be a reasonable but aggressive time frame for you to feel like you can come back and do a vote by email? Is having a vote deadline 2 weeks from now reasonable? Do you have an alternative proposal? Senator Dingra. You are on mute, I think.
Sorry about that.
No worries.
So is the vote just whether we should have a work group or not? That's the vote we're talking about.
It's
right?
a vote for the proposal. So if there are amendments to be made, we may, Carrie said she had a potential friendly amendment. If there's amendments to be made, we would need to make those and then ask all of you to vote on the full proposal. Betsy, please correct me if I have that wrong.
No, that's absolutely correct. And this, what we are putting forward is an initial proposal. We fully expected that there would be some friendly amendments and that, we would need to think about how we actually execute to this. So yeah, happy about that.
Thanks for that clarifying question. May I just add too, because we need to make sure that we're maintaining transparency here. So any voting decisions and discussions about amendments that you make would need to be, we would need to make sure that our community members are aware of those. So what I might propose is that we make all of the deliberations, anything by email, available, like we include it with the meeting summary from this meeting that we post to the web, and that way we're making sure everybody's aware of those deliberations.
That sounds great.
Okay, so thank you, Senator Dingra. So how does, I'm just throwing this out there again, because I think Betsy had mentioned it would be ideal to have this work group getting going by mid-August. How is 2 weeks for a deadline for a vote on the full proposal with amendments?
Sounds good.
Yeah.
So
Carrie?
someone else speaking.
I think that we in Healthcare Authority are going to dive into it and have started last night. So 2 weeks sounds fair as well. Thank you.
Thanks for getting that head start, Carrie. Michelle, how does that feel to you? I know there's a lot here, so.
Yeah, that works for us too. Thank you.
Okay. Okay, please let us know if, as you're digging and you're finding there's more layers to this onion than you thought there were, and we can make adjustments. I'll make sure that Amber is aware too, since I know she raised that concern. Steering committee members, anything else to add to this deliberation before we circle back and just remind everyone what next steps are? All right, so you have the proposal. I believe, Betsy, do we have that posted to the web as well for our community members, or we can do that after the meeting, presumably?
I'm certain it's not posted yet.
Okay, we'll get that up so community members, you can see it, but as steering committee members, you have the proposal. If there are any amendments that you would like to propose making to it, please email those thoughts. We will compile all, we're going to spare our community members the back and forth on the emails, but we will compile all of the outcomes and put those in the meeting summary so that community members can track how the discussion is going. And then our plan is by end of day, 2 weeks from today, which I think is the August 3rd, will be when we plan to get your votes on whether or not to move forward with said proposal. So thank you everyone for that great discussion. All right, we're right on time here. Action items and next steps. I just spoke about those. Betsy or Nicola, did I miss any action items? Nope. Okay. So we're going to move into our public comment period. I have 3 people who have signed up, one person who signed up before the meeting, and 2 people who signed up during the meeting. So I'm going to read those names, and I'm just going to briefly remind everyone about how we're going to do public comment. I am going to use the timer just to, contain the public comment a little bit, but I did ask folks to let me know if for any reason they need an accommodation. I have not heard any. I'm going to read all 3 names, and then we're going to take you in this order. The first person actually I did not see on our attendee list, but she might be here. They might be here using a phone number. So I'll read the names anyway. So we have Rachel Bright, followed by Karen Kelly, followed by Elena Moore Caldwell. And I'm going to ask you when it's your turn, if you could turn on your camera, if that's available to you, and start by introducing yourself. And then you can make your comment. Also, if you have a written version of your comments, if you could please email that to the HCA email box, which we'll put in the chat momentarily. That helps us make sure that our steering committee gets to see and take in the whole comment. All right, so I'm going to first make sure that my ads are all deleted from my timer since we had that problem before. Then I'm going to share the screen. Make it a full screen here. All right. So first up is Rachel Bright, followed by Karen Kelly, followed by Elena Moore Caldwell. Rachel, if you're here, could you turn on your camera, please, and go ahead and state your name. I just had this, whoops, sorry. I just had this ad pop up. It's not going away. I apologize, everyone. Please ignore the shoe ad at the top. All right. You can see what I was searching for last night. Okay. This is just giving me a really hard time. You know what? I'm not going to do the timer because it's just giving me too much of a hard time. So I'll stop the share here. All right, let's move on then. Let's go with Karen Kelly, followed by Elena Moore Caldwell. Karen, when you're ready, please turn on your camera.
Hi, so I needed to write this out because this is my passion point and I do not want to go over my time. So I'm just going to read it. So I apologize if it sounds unpracticed. It is, but I want to highlight the importance of training responders who will be working with youth in understanding family-initiated treatment and the rights it provides parents in supporting their youth in behavioral health recovery, specifically being informed and educated on RCWs 71-34-600 and 71-34-650, so they can better support parents who are engaged in the recovery process of their youth. The age of consent is 13, and it was designed to allow youth to initiate treatment without parent consent. In that, it also allows them to decline treatment. Many times, both parents and system partners recognize the need for a youth to receive treatment, and they can partner together to help support the youth in identifying the least restrictive setting to help meet that youth's needs. And often this is not happening. In my experiences, responders have been highly informed on the age of consent and not as informed on the rights that parents have in supporting their youth in the midst of that age of consent. My experience with crisis responders was truly devastating for both me as her mom and my daughter who was in crisis. And all of the times that we reached out to crisis response ended up with an escalation rather than any de-escalation or resources. And they ended up being something that caused more harm than good for us. They all ended with either the police coming out or with us visiting the ER and my daughter being housed in the ER for lack of beds. Now, these are some of the reasons that those of us with lived experience must be included at all tables as this process moves forward. We have to stop making the excuse of unintended consequences when things don't go as we planned. My daughter was classified as an unintended consequence of the age of consent law numerous times, and she is not that. She is a living, breathing human being who easily could have died while system partners and her loved ones watched her decline treatment when clearly she had a need of treatment. And this was done with the support of certain system partners who really just didn't understand the goal of the age of consent, and they weren't informed on how the law supports parents who are truly engaged in supporting their youth in recovery. So they were unable to help her when I know that they wanted to. And we really need to make that change. And this process that we're doing now gives us an opportunity to do that. So I just hope that we can. And I'm sorry if I went over. I wasn't watching clock.
You were perfect, Karen. Thank you so much for sharing that comment. Up next is Elena Moore Caldwell. Elena, when you're ready, please turn on your camera and introduce yourself.
Good afternoon. I'm fortunate in the regard that I not only have lived experience, but in many different realms, but I've spent 15 years going to school as a single mom with 2 children with unique needs. And I now work as the behavioral health navigator for the 3 police departments in the Grays Harbor area, Aberdeen, Hoquiam, and Cosmopolis. One of the things I would like to share as a professional is that first responder, when we respond in our area, our hospitals go on a mental health divert specifically. So we are not allowed to take people in crisis to the emergency department in our county. And so having only 3 medics in our county, we just don't have transport. We don't have that capability is lost to us to get people to an emergency department. And we are left holding the bag. I mean, I took a teen with suicide ideation out of the county at 2:30 in the morning, and in order for our medics to be able to stay in the county for other emergency response. So when we're applying the crisis response, when we're discussing crisis response, especially for rural communities, all community partners involved in care need to be active participants in that process of care. Otherwise, the whole system fails. And my youngest attempted suicide 2 Fridays ago by walking on the freeway. And, you know, it is so challenging to get the right help as a parent, even if it's for someone over the age of 13, to get them into the right facility, and for the facilities to keep them long enough to see that medication stabilization is working before releasing them back out. So there's a lot of unique needs, but especially in our county, because our hospitals are failing us. They're just not available for folks in crisis.
Thank you, Elena. I'm going to just leave our public comment open for 1 more minute. If someone else would like to make a comment today, please send me a chat or raise your hand. I'll just give it another minute here. Okay. In the meantime, okay. In the meantime, folks, I did get a couple of questions from community members during our meeting today that we weren't able to get to because we were focusing the steering committee discussion. I'm going to relay those questions to our steering committee members, and please also, please do send them to our email box, and I'm going to post that in the chat. Many of the questions that you all have shared are really important ones that should factor into our deliberation. So here's the email, and you can also go to, I'll put the website as well. I know most of you are familiar with this, but if you're not, this is where you're going to find a lot of really good information about the process and some of the materials we've discussed today. All right, I'm not seeing any other requests to make comment today. I do want to extend a special appreciation to Shoma and to Karen and Lena for sharing your stories with us today, your personal experiences. As Vipasha said, it's very brave and important. Thank you. Thank you, Shoma. And steering committee members, as ever, thank you for your great conversation today and for your thoughtful suggestions for how to move forward. We will be circling back with you with next steps for that vote to take place August 3rd. Everyone, thank you for being here. I'm going to just give it to Betsy to say a final word or two, and then we'll send you off for your afternoon. Betsy?
Thank you, everyone, for attending. Looks like we have a really a large number of people listening in today. Appreciate your interest in this very important work. Thank you to our steering committee members for being flexible with this walk-on proposal, essentially. We'll talk more about that. Have a wonderful rest of your day, everyone. It's sunny outside. Grateful for the sun.
Take care. Bye, everyone.
Bye-bye.
Thank you.
Bye-bye.
Thanks.